There are three reasons why I'm so humbled and overjoyed to connect with you all today on Sunday Sips. First of all, you are all surgical robotics titans, and together we share over a century of medtech commercialization and R&D experience. The products you have developed for market insights and brought into the hands of clinicians have had a substantial impact on progressing global healing at scale. And I'm so excited to explore best practices and go to market strategies for complex surgical robotic solutions in 2026. The second reason I'm so humbled and filled with joy is that the three of you have built a remarkable friendship over the years. And while you've worked in a ruthlessly competitive market, your collective voice and partnership as digital content creators has continued to lift up our medtech industry. Kashif Ikram, first vice president of Total Solutions Robotics in Europe at MicroPort, you somehow find the time to also co host the Our MedTech Lives podcast, where you explore stories of veterans in our industry to encourage the next generation of medtech innovators. You also have a humbling resume where you've brought value to Smith+Nephew, Zimmer Biomet, Edwards Lifesciences, Medtronic, Siemens Healthineers, Distalmotion, MicroPort, and multiple startups. My favorite quote from you is, "This is pretty cool. I can launch it," as you were casually referring to Medtronic's Hugo Ras. Tetsuya Nakanishi-sama, Chief Executive Officer of Kawasaki's Innovation Center Europe and Executive Lead of Commercial Adoption for Metacroid's Hinatoli robot. You also put out lovely content on LinkedIn about your team and your experiences in Europe. We share a nuanced cultural experience, as now we're both not fully Japanese or fully Western, as we've raised our families across a global context. And you carry such an uncommon kindness and empathy in the way that you lead. I love how faithful you've been to Kawasaki over the course of your over the course of your career, progressing from engineering motorcycles into surgical robotics as one of the first members of Kawasaki's joint venture with Sysmex to create Metacroid. And I'm excited to see what new healthcare solutions launch from Kawasaki's Innovation Center Europe in the years to come. Finally, Steve Bell, ex-chief commercial officer of Europe's largest medtech unicorn, CMR Surgical, with over 1.5 billion in capital raised for medtech startups. The rigor and passion you bring into content creation fuels your 25,000 followers to take greater risks on behalf of the patients we serve. Just under a year ago, on June 8th, 2025, you changed the trajectory of my life as the first guest on the Sunday Sips podcast. And you've opened up so many doors behind the scenes to fuel my own entrepreneurial journey, which included the launch of Moonlight Medical, where I support stealth mode startups. I have deep reverence for the impact you've made and continue to make both in medtech and as a father. And I appreciate that you helped me bring Kashif and Nakanishi-san to this discussion, as they're both incredibly busy. Now, the third and final reason that I'm so humbled and filled with joy is that I have no idea where this conversation will take us. And in honesty, I've never curated a roundtable discussion like this before. One of my partners from Moonlight Medical, Jing Tian, has helped me curate targeted questions and a surgical robotics commercialization case study in neurovascular for today. But I'm so curious how we will naturally wander in the moments to come. You all have remarkably big brains, so it's a privilege to officially welcome you to the Sunday Sips podcast, where I carefully curate the latest big brain insights worth sipping on. So that's all I got. Let's get to work.
Thank you. Thank you for that incredible welcome and introduction.
Of course.
And yeah, I also like really appreciate such like a really great opportunity. And I can just like want to say, so like you can say to me Tetsuya, and you don't need to say Nakanishi-san. Like kind of this is like a typical Japanese way, but for me like really weird feeling. So that's why like I always don't say like Nakanishi-san or something. Kind of like just like a call Tetsuya. And same as Steve, same as Chief. That's like really better. Yeah.
Tetsuya, I appreciate that. It's a weird
Yes.
habit from living in Japan. And even when I wrote Nakanishi-sama, I was like, he'll feel uncomfortable about
Yes.
that. But you really, within Europe, you were leading at such an honorable
Yes, like
level.
always I ask many people identify me Japanese if so use family name with son, but this is for me really weird. So that's why really I'm so happy to you call me as a first name.
Yeah.
Okay.
And on the flip side, I always call Steve San whenever I speak to him out of
Yeah,
reverence
son.
for him. He looks a bit like a samurai to
Weird.
me. So
Look, I dress for the part. I'm with my colleagues who have great products from the East. So I came,
Exactly.
in the vibe and in the feel.
So, hey, pretentious engineer here. I know you didn't ask, but you are in for a treat. Now, friends, I have been deep in the editing process of this incredible conversation with 3 robotics titans, and they have a combined century of commercial wisdom. And I want to provide you 3 reasons why I think this discussion is going to be worth your time, and then we'll jump right back into the show. First of all, Steve Bell is absolutely incredible, ex-CEO of CMR Surgical, 1.5 billion raised for medtech startups, and he's an alumni of the show, and just overall a lot of fun. We get into a lot of interesting nuances of what kills startups in the surgical robotics space during this call. Number 2 is going to be Tetsuya Nakanishi, CEO of Kawasaki's Innovation Center and head of Medicroid's Hinatoli robot and its European access. And we talk a lot about commercialization in Japan during this discussion and some of the misconceptions a lot of US and EU based companies have when they're considering commercialization in that region, which is a lot of fun. And then finally we have Kashif Ikram, first VP of Surgical Robotics Europe at MicroPort, and he's ex everything. His running log of impact in medtech is crazy. One of the things we celebrate is just how many telesurgical cases have been done by MicroPort, which is quite compelling. And it's really neat seeing the banter between these 3 guests. So I hope you get a lot of value out of this that you could apply within your unique context. And if you can hang on till the very end, we're going to go through 5 big brain ideas that I synthesized from the whole talk. We go a little bit deep at the end, so don't get lost or leave. But anyway, you can zip on that. And here's a couple words from this week's sponsors. So this episode of Sunday Sips is caffeinated by me. Now, for folks who don't know me, I worked for Johnson & Johnson for a decade, progressing surgical robotic technology such as Otava. I directed front-end innovation in Japan, in marketing. I traveled the region extensively with clinicians, understood their unmet needs, and led an ecosystem of engineers to develop new technology on their behalf. And I love elevating the voices of clinicians and the patients they're so desperate to serve, as well as progressing meaningful innovation on their behalf. And in 2024, I took a crazy exit from J&J after a decade there, tried to go all in on starting my own business, failed at it in Japan with 4 kids, crashed out in Chicago, co-lived with my in-laws for a year, getting my 401k to double down, worked third shift at Amazon for a year to triple down on my ventures. And I finally launched a company, Moonlight Medical, where I'm scaling a global team that helps you triangulate clinical unmet needs, technical feasibility, and commercial viability. And I have 8 players, heavy hitters, supporting me and my medical so that we can support you. I have team members in San Francisco, Austin, Texas, Cincinnati, Chicago, Paris, London, and Australia. And I have experts across go-to-market strategies, upstream R&D, fuzzy front-end kind of work that can go from white paper to a full-fledged concept or even FDA submittable solutions. And I have folks that can do biodesign and can do ethnographic research to really hear the voice of clinicians and figure out how to translate that into meaningful requirements for your large robotics company or for a one-off medtech device. So if you're curious about learning a bit more about Moonlight Medical, our goal is to get you centered in that innovation trifecta. And I also do a lot of work with brand presence if you're trying to attract VC funding, create bidding wars, or attract top tier talent. But anyway, that's the next sponsor of Sunday Sips. They keep changing the world. This episode of Sunday Sips is caffeinated by Kinetic Vision. Throughout my decade-long career in surgical robotics, I've worked with many medtech consultants, and without question, Kinetic Vision stands in a league of their own. They masterfully curate the art of science, accelerating innovation through advanced technology. Their capabilities, creativity, and candor have consistently made them my most trusted digital external innovation partner. We've collaborated across continents and time zones, tackling challenges and unconventional ideas and taking them from white paper to fully functional MVPs. Their contributions, from early concept generation to usability studies, test automations, digital twin creation, VR simulations, and beyond, have been pivotal in moving breakthrough ideas towards real-world clinical use. My partnership with Kinetic Vision has been a decade in the making, and it's an honor to introduce you to their world-class capabilities. If you're facing technical challenges beyond what you can do in-house, I trust Kinetic Vision to help you find the path forward and empower you to innovate on behalf of global patients and the clinicians you serve. Finding the right partner to drive digital transformation within your organization and product pipeline is critical to the long-term success of a medtech business. So check out the link in the description below to take the Digital External Innovation Readiness Assessment, which includes a waitlist for experiencing a discovery session with Kinetic Vision. It'll take you less time than it takes to finish your coffee or tea, and it'll provide you with greater clarity on if Kinetic Vision is right for you. Anyways, you could sip on that, and let's get back to Sunday Sips.
You're our guru, so we should give you the reverence.
Steve Sensei.
This is going to be fantastic. I'm so looking forward to this conversation.
Well, thank you so much. So I guess where we could start, because I'm new to wrangling a conversation across all three of you. You all have so much you can share. Maybe how did you all meet? And then we'll get into your journeys within medtech. But I know that you've been crossing paths for decades now at this point. But I'll let you go into some old moments or stories.
Wow. Well, I can tell you how Steve and I met, firstly, right? Because we going back about a decade, we would go to congresses, and Steve was working on the CMR system where, he was head of commercial and launching that. And I was launching the Hugo, and we were quite small. We'd go to congresses, and often they'd have the evening event, and Intuitive Surgical would have a bunch of people there, and they would fill a table.
Yeah.
But CMR and Medtronic couldn't fill a table. So they always used to shove us on another table. So we'd always end up sitting together. And it turned out to be the most fun table in the whole room, because we would have a couple of drinks and we would just talk about everything else under the sun, solve all world problems. And that was just, we became firm friends just from that, because we're both Brits. We have the same sense of humor. And then Tetsuya, I think we were at a congress where they put our booths right next door to each other, and we just spent the whole day talking to each other.
Kind of really connect to LinkedIn and let's talk. Then kind of start to talk and really frequently talk. And another day had a congress next door. So let's say kind of we start to have such a small world we recognize.
Yeah.
But Tetsuya, I met you because I did, I think one of my first videos I did was when Medicoroid kind of first appeared. And
exactly.
I think we reached out through LinkedIn, if I remember right. It was either LinkedIn or email. And we just had a really great conversation. I remember we got on the phone together and we really talked. And I think we talked for over an hour that first time. That was lovely.
Like 3 or 4 years ago, kind of, as you said, Steve, I posted a LinkedIn about medical thing, and we start to connect you. Then I had a really great conversation. Actually, first conversation already close to 2 hours, and really many points, really let's say mature understanding both sides, and one things really almost kind of talking about 100 things. So that's why really comfortable feeling, and knows really Steve knows really many thing experience point. So that's why really let's say so his story is always smells so realistic many things. So that's really nice. A consultant, said, something kind of really just something just a cinema story things. But Steve's story is a really real smell thing. So that's why I am happy to touch Steve and Kashif as well. Really his conversation topics is always really realistic, really focus on commercial things. That's really happy to have this conversation, which is sometimes really difficult to have our colleague in Japan sometimes. So Japanese Japanese mentality is really different. So that's why I am so happy to talk with you. That's really, I got feeling fate to start connecting with you guys.
And I got to meet Nakanishi-san, or Tetsuya. I have to retrain myself. Tetsuya. Tetsuya and Kashif. I met you both through Steve's content. So he flew out and interviewed both of you and sat in front of both of your robots. And it helped me kind of send the right LinkedIn messages to connect. And I didn't realize you had a partnership and friendship behind that. But I was just really curious on all the experience I had with Otava at J&J. It's really nice to connect across the industry with other people progressing novel solutions in these spaces, because it's such a complex, challenging area to develop and deploy healthcare, but it's so impactful to patients. And I just love the way Steve curated both of your stories, but also the story of MicroPort and of Metacroid, and also the way that Steve kind of unpacked some of the, I guess, biases that exist from innovation that could come from China or even from Japan, and to just make those solutions accessible.
He's a one-man CNN, is Steve. He does everything. Recording, sound is pretty amazing. And he's a great presenter as well. So
he's got his AI. He's got his whole AI cinematic studio now too. It's your other side quest that you're doing for horror.
Yes.
Right?
Yeah. That was what the ringing was. It was the team from Los Angeles probably telling me something exciting.
It's awesome. So I think so let's kind of go around the room a little bit, but how did you all progress into MedTech? Like take me way back. Like I know that Tetsuya had a reluctant journey almost moving from Kawasaki when you were kind of nudged towards it. So like, how did you get into these spaces that heal?
Yes, how I described this point, and from me, I can say, so so basically when we start medical, at that time, let's say Kawasaki is no experience a medical device, and they sure our other parents company Sysmex, but they are working on diagnostic field. Surgical field is totally different. So how I start this business? First time I attend a case observation in the Kobe University, more than I think kind of 200 case attend. That time I didn't know anything about this. Also really terminology, even Japanese word, I did not understand everything. So I just take a note and to start to research and learning a lot, and that's really process. Steve and Kashif had a really long time experience a medical device, but for my side is a totally different. This is a 15 years experience things, but a starting point are totally different. But we are really recognize we had many technology can be contribute to medical devices, but how that's really consider. And the Japanese culture is very different, but the European culture is more open. How we connect to people and how we dive into a real life world. So that's really driver to connect to people. Then we dive into brush up the system and really something kind of test right? And a really evaluation time are really important. Invite surgeon and they test our system and brush up, really continue to brush up, continue to optimize. This is really process we did for one time. But this is just a technical side as a build up products. But on the other hand, the commercial part is totally different. So commercial part, we need to have more business partner, distributor as well, and more device partnership or AI partnership. These are really necessary to have next power, next energy. So that's why we are basically consider really not only focus on in-house things. So as a big company, consider like everything in-house, and acquire the company, that's like a really normal way. But for us, like really not size of like this, like a big company things. So that's why we are considering to have a business partnership. And we are considering to establish to the company Strasbourg Kawasaki Innovation Center is just a co-creation stage. So like we can invite many companies then like together to build a new value. I think kind of like for my perspective, this is the only way to build like a success story for like a medical device for our size of company. Yeah.
That's beautiful. And Kashif, what was your pathway into medtech?
Into medtech. Well, I graduated from university and I wanted to be an academic. I did zoology and psychology, and I started a PhD. Yeah, it was very, very useful. I started a PhD in in pigs, looking, the pigs had to be reared in fields instead of in battery conditions, but they didn't realize that pigs try to kill each other when they're pregnant. So my job was to stop them killing each other, which I failed at. So I left after 6 months. I decided this wasn't the job for me, and I joined the pharmaceutical industry, and I did a couple of years of that, which was great learning in the medical side. I get to apply my biology knowledge and business, but my God, pharma, having to read the script to GPs every day, my brain was starting to dissolve out my ears. And if I'm truthful, my girlfriend, or soon to be ex-girlfriend at the time, was from Dubai. And I thought, I want to go to Dubai. So I applied for some jobs and I got interviewed by Smith+Nephew, some orthopedic stuff. And they offered me a job. So I moved to Dubai and I got into orthopedics. The relationship didn't work out, but the relationship with med device was a match made in heaven. So I've been in ever since. I came back to the UK and I joined Zimmer, and my career just has been in medtech ever since. I've not looked back.
And you're in Sweden now. So where have you traveled around? Because I know you went UK to Dubai, and then I know you hopped.
So I lived in Dubai back in the 90s when Dubai wasn't anything like it is today. I worked in the World Trade Center, and the site out my window is just desert, and now you can't see the World Trade Center because it's surrounded by big skyscrapers. So I went back to the UK and I worked my way up through some companies there, and then Edwards Lifesciences moved me out to Lausanne in Switzerland in 2005, and then Covidien was formed and they moved me over to Zurich. So I stayed in Switzerland for a very long time. I had some stints in Italy, not as long as nice as Steve's, but then in 2018 I moved to Sweden to be with my now wife. So I left the UK in 2005 and thought I'd be gone for a year, and haven't been able to go back to the UK, and I'm not sure I will, to be honest.
Excellent.
I'll move back when Steve does. We can be neighbors.
And Steve, I know your backstory from the last 2 times you've been on the show, but what's your wandering path through sales at Ethicon into medtech?
Well, I'll go into a slightly
I'll
go into a slightly deeper story on this one, because there is actually a bit more to the background of this, which is quite hilarious. So you have to remember, when I was applying for jobs, I came out of university and I was broke and hungry. So I was working on a building site, and I was hodding bricks, taking bricks to the top of the building site. They were the days with no safety harness, no helmet, no nothing. I mean, you just literally put a giant thing of bricks on the back and went up a giant ladder. And the only communication routes in those days, because this is pre-mobile phone, the only communication route in those days was a fax machine. And luckily, the guy who was running the building site had like a really bad fax machine. And I was a little bit like Cash. I was going after farmer jobs. And the only reason for that was I heard that you got an expense account and a car.
Yep.
So that was actually my motivator for getting into pharmaceutical industry. And I did have 2 degrees. I've got a physiology and a pharmacology degree. I thought, pharmacology, I'll go work in the drug industry. And I went for several jobs, but but I was always considered too young because I'd actually got my degree before I was 20, 2 degrees before I was 20. And I looked about 12 years old. I remember looking at the time, I looked about 12 years old. So they just kept rejecting me before they wouldn't even interview me. I would walk in the room and they'd say, no, you're too young, and kick me out. And one day I got another great fax through because the agency sent the faxes through for a pharmaceutical job. And unfortunately, a cup of tea got spilt on the fax, and all I could do was work out the address and the time and the name of the company. And I turned up for my pharma interview, which was Ethicon. And the guy just looked at me and said, we're not a pharma company. And I said, but you do these great drugs, Vicryl and PDS. And he just said, we're not a drug company. We're a suture company. This is not the suture division. We're actually setting up something to do stapling. And I said, look, I'm hungry and I'm broke. Just give me a job. And that was basically the way I got into the industry. And a great guy called David Follows, who thought I was a lunatic, and he still does, just basically threw mercy on me because he could see I was super, super skinny because I wasn't eating properly and working on a building site. And he threw mercy on me, and that's how I got into the industry.
Yeah. You know, when I'm on my podcast and we ask people week in, week out, how did you get into medtech? 99% of them fell into it by accident, right? It's just how it was in the day. And I think that's one of the things we're trying to just make people more aware of this great industry, great business, where you get to help so many people. So we should make people more aware of it, right?
Well, I think you're right. I think I had no clue that med tech existed when I was. Just didn't have a clue.
No, you don't think about how all those products get inside, inside the hospital, right? The same way you don't think, back in the day, you didn't think, how does an army get guns and airplanes and tanks? Somebody sold it to them. But it's, you don't equate that, with, like bread and jeans and someone selling you TVs. But it's basically, business.
Yeah, I found it on accident. I was at a career fair in college, not looking for a job because I was planning on extending an extra year so I could actually get more out of my courses. And so I had this awkward slush year. And then I saw a J&J Ethicon booth, and I just went up to the recruiter. I was like, I know what J&J is, but what's Ethicon? And that just started like an hour-long conversation about harmonic ultrasonic technology, staplers. And it was the most awkward like resume pass of my life. Like after just holding my own with an engineer and not really looking for a job, I was like, so do I give you my resume now? Like it was just really strange. And it opened up an interview, and I was married in college, which was also strange. So they set up a co-op for me. So I had to take a break from college. My wife took a break from college. We went out for 6 months, extended it through the summer. And I worked in life cycle on staplers, clip appliers, a lot of stuff that Steve was probably selling, and connected with a lot of the old timers there that had built it out in the 90s. And I just found the whole industry fascinating. And then it rolled into a decade-long career working in surgical robotics and then out in global strategic marketing in Japan. But it's all those like little moments of like the right touch point, someone taking a shot on me because I was complicated. Not unhireable, but just like it was a hard situation to house me and my wife and move us out. But I have like how life's unfolded from that has been so fulfilling. And now I'm in entrepreneurship working on stealth mode stuff. And like that never would have happened if I just ended up working at Caterpillar, which is where like a lot of people go, the University of Illinois. It's a very honorable profession, but it's different than what we do here. Yeah.
Sorry, I'm fascinated by Tetsuya's move from Japan to Germany. I mean, that's big, right? So how did that come across?
I can say like this like a story. So originally, like really, I want to be San Jose, like really American, like a really bright sky, everything. And like I always ask like my boss, like current CEO of Kawasaki, I want to be like a San Jose, like I want to like build like a medical device, like a business or something. And like he promised, but like, suddenly like really he said, okay, so like you should be Germany. So like at that time in November. And gray sky and everything kind of like a really dark feeling. I said, no. I said, but This is a kind of like a really medical device, like a really like working like a much more like a really open and to like connect everybody. Like you should be here. So that's like a really big change for my family. Like really never had a life in outside Japan. For me as well. So that's why like a very tough thing. Also like English, like 2015 until 2015, I never speak English. So that's why like sometimes I reject a business trip. But this is like no way, like not possible to reject anything. So that's why like I can say like a survival English, like I can say. If I want to survive, if so, I need to speak English. So that's the first way. So that's why like I really move out from Japan. That time I'm like a really not so like a really big struggle because like my style is like already open. So and like really I really love to talk to people. Japanese like people like a typical Japanese people are quiet. They are like always poker face and they always said like they want to say disagree. If so, like they said, okay, I will get back to you later. Then like they email to somebody, yeah, I won't take this one or something. But like I'm like too direct. So that's why like Japanese people said, Nakanishi-san, like you are so straightforward and too direct. In Japanese, this is like really not adult behavior or something. But like for me, like really, this is like my authentic style. So that's why like I am so happy to be Europe side, and everybody like really happy like to talk with me like for example like Professor Jack Malesko he was like really surprised to talk with me. Are you really Japanese? He asked me like 5 times. So because he knows like kind of a typical Japanese style. But for my style is like a really quite fit to maybe the kind of like a Western culture things. So that's why for like a Kashif's question, like I can say like a really let's say no struggle to adapt to like a European culture and much more tough. I trip to business trip to Japan that time. I am like really worried about how I behave. So that time like really consider. And like, that time like I always kind of write down how to speak like and like everything kind of like a script to describe. Then like I can speak. So that's why like I am also like really tough. Speaking Japanese is like much more stressful. I can say. Maybe like this is really not typical Japanese. Yeah, yeah, bit strange person. Yeah.
Yeah. How's your German, Steve?
Good.
Good.
No, not. I can understand a little bit, but because remember, I worked for Ethicon Endo, and we had our headquarters in Hamburg. So I used to travel to Hamburg every week, and I used to, well, it's actually Norderstedt, and then they got people in Hamburg say no, it's not Hamburg. They always tell me it's Norderstedt, and that's actually where they had the big plant over there, Robert Kochstrasse, which was just on the outside, and they built there before I was in J&J well before they built the European Surgical Institute.
Yeah,
and I saw that whole. I saw that got built, and then I saw it close just a couple of years ago as well. So that made me feel very old that I went through the whole cycle of a training center.
Well, the whole laparoscopic surgery life cycle, right? From introduction to training to becoming out competed by robotics.
Yes.
Fantastic. How's your German, Joe?
Mine? I have no German. My Japanese is like sub-intermediate, and then I speak English.
Oh, very cool.
I studied in college, and I went from a C+ my first year to a C to a C-, and then that's all the credit of Japanese I got. Like it was enough to graduate. And then I started going out every summer for short-term missions trips to help small churches. So we did kids camps and cooking classes. And that was kind of the first experience in Japan. So the very first day that we arrived in Japan, me and my wife, the pastors like put us in a hotel across the street from J&J headquarters. And my signing bonus from J&J was what paid for the first trip. So it was really interesting for me to go at the base and kind of look up at Chiyoda and just start to imagine like maybe I could get out here vocationally through J&J someday. So we did trips every summer. And after 8.5 years working in handheld instruments and robotics across Ethicon, Verb, and Auris, I got a shoulder tap to direct front-end innovation in Japan, which was a global strategic marketing engineering hybrid role. So it was all about connecting with Japanese clinicians, traveling the region extensively. I did 40 plus case observations, ethnographic research, post-operative interviews. And then the goal was to take those insights back into upstream R&D and biz dev and try to get different projects progressed around those innovations. So that was a 2.5-year role right at peak COVID. So we moved 12 times in 1 year as a family with 3 kids. And then had a messy exit from J&J in 2024 when my role got impacted. So we tried to start our own business in Japan in order to continue life there because we had our 4th child. And after 7 months, we hit zero, like borderline bankruptcy in a foreign country with 4 kids. So we reset in Chicago and then pulled our 401k, which is our life savings, continued to double down on the business, and then started to get some traction probably like 6 or 7 months ago. So like now things have started to equalize in those spaces. Then I've started to attract like global roles in parallel. But yeah, it's been a pretty wild journey. Japan's awesome, but I'm not proficient. I can get by.
The resilience is impressive. That's but you know, I've never launched anything in Japan. It's the only region of the world I've never launched anything. And the reason for that is because the regulatory takes so long. You know, I've launched products, US, Europe, Asia, and then by the time we get to the Japanese launch, I've already left and I'm already launching something else, right? I've already started another project.
That's
So
like really
yeah.
not fast. That's why like when the company want to enter Japan, that time you are not there.
No,
Yeah.
3-4 years down the road, I'm on some other project.
Yeah.
And I think,
Ethicon had that. Go ahead.
Yeah.
Go ahead, Steve.
I think that's why Hinatori's been interesting for me. I think it's the only robot that started in Japan. And I understand it's a Japanese company, but to get the PMDA straight off the bat and be there, I found that really interesting. That was the route that you went, and then you go from there outwards. Yes, culturally, I understand why they went there first, but it's a testament, I think, to the quality of the product that you got PMDA first in Japan and then roll out.
I can say like really Japan, like really one more like a Japanese like a robotics company there. I think like I forgot like the name of the company, but like kind of why like we start like a Japan, sure like kind of home country, but also had like a really let's say like a Kawasaki, like a really start like a new medical device business. If so, like we need to have anyway something as a country like a really necessary to have a support. Something kind of like a Japan, like a government also consider robot and the medical is like a really big 2 column things. So that's why like if like we start from Europe or America, if so like this is like a little bit like a really tough to explain to government side. So that's why like how all people and like to support like this is like really let's say like official support things everything. So that means so how we like really involving people and how we expand like globally. If so like as a government side like really country wise like really necessary to like together. So that's why like we decide to start like Japan and like a Japanese surgeon are like really so like really let's say dedicatedly like really focus on like really surgery, and sometimes like really takes a time, but like really it's like really better to collect like a requirement for like connect to like really safety things. So that's why we consider and the engineer in Japan and now and so like very close to a surgeon clinician, and we are like really consider like let's start to close to Japanese clinician, then like try to optimize Hinotori system until certain level. That's like our intention behind starting from Japan. Even if like we know like a Japanese market is like really small compared with Europe and American side and like Asian side, but we are considering to have like such a reason. But real market, we understood like American side and like a Europe side and like now like a Asian side. So that's why now like we are step in real stage now. Yeah, very close to have a CE mark a couple of weeks. So that's why I am so excited to have like this time.
I've launched several products from the US into Japan. So I've actually had that experience, and it was an eye-opener for me. And for those of your listeners who are listening, who are trying to understand medical device, every country is very different. And one thing I'll tell you about Japan was we got so shocked by the incoming quality control check. The incoming quality control check was absolutely insane. We had a stent at the time. It was with a company called Insight, and we had a stent, and it was a really great stent. And the first thing we got feedback on was, we don't like the quality of the cardboard on your box. Okay, they said it felt too thin. The paper for the IFU, they really didn't like the quality of the paper for the instruction for use, which until I went to Japan, I thought people never read it, to be honest, but it seems they do. And then we kept getting rejected because of things like we would have to put a cellophane wrapper around the cardboard, so it was wrapped in cellophane. And then in our shipping boxes, the cardboard box we shipped in gave particulate matter, tiny little dust that came off the cardboard in shipping. And we had entire lots of product rejected from incoming quality inspection in Japan because there was dust on the package. Things like that. It was very amazing.
This is like a really great point, like Steve, pop up, and let's say this is really one of a difference from other country. So other country regulation really not focus on this matter, but really Japan has really specific point to point it out. So that's why even if really fulfill technical documentation there, but sometimes really found this point is not fulfilled yet. If so, really another 6 months spend really easier, and we lose the time. So that's why really necessary to have a local understanding things. So let's say intuitive surgical case. In Japan, former time, they don't have any reimbursement things. If so, really, even if approval by PMDA, but they had no chance to expand robot system entire Japan. But after reimburse robotic surgery, then a really steep curve to expand there. So that's really different from other countries. So reimbursement is really big topics, but Japan is most focused reimbursement things. If not have a reimbursement for specific for device, they had no chance to enter market. So that's also a different point. So that's why really every country had a totally different manner, different perspective. And Japan is a really specific country, and not say really bad. So I can say just different. This difference. Sometimes I use the word Galapagos, and some Japanese people hate me because I use Galapagos Japan. But let's say I want to say just a difference from other country. And so that's why we need to have each country a different strategy are necessary.
Yeah.
And I think if I could just expand around this topic a little bit from my time there, Kashif, what you're sharing of never commercializing a solution in Japan, we had the same problem at Ethicon, where our product launches in Japan would be 3 to 5 years latent from initial US launch. And there was this consistent frustration because you'd spool up a new product development team, they go through the whole launch and stabilization, and then eventually they'll be scattered to new projects, and then there'd be all this inbound rework necessary to get through Japanese regulatory bodies. And it was really a cyclical issue for multiple decades. Within our org, and we started proactively embedding teams from Japan in US and Cincinnati to sit and proactively start regulatory dialogues faster to try to pull that in. So if we look at our powered state, I say ours, that's not mine anymore. But if we look at J&J's new powered stapler echelon, I think it's 3,000, that, they cleared Japanese regulatory only 6 months behind US FDA. And it was because we were proactively partnering and setting the expectation on R&D teams that Japan is an essential launch target just as much as China, EU, and US. So we have to proactively partner. And I think a lot of times Cincinnati is a very Midwest, US centric culture at times. I had to help a lot of Blue ash. Blue ash. That's true. I had to. That's where the office is located. For context, a lot of times I just had to help those team members have more empathy to the different value drivers within Japanese culture that are creating more work. We would have a product that we would do all our claims testing for that would work for the US and EU for competitive claims against COVID or Medtronic. And then when they get to Japan, they can't do the same head-to-head competitive claims. They need different clinical data to show that it's superior to your own product, or just it stands alone as clinical data versus competitors. They'd come back to R&D and we'd be like, we don't have resources or people to do that. So there's always these mismatches based on empathy and strategic prioritization from leadership. And then you get on the ground, I'd get on the ground in Japan and connect with clinicians, and they're used to waiting 3 to 5 years for product innovation. And they feel unheard within the market because there's a lack of empathy in orgs around strategically prioritizing that partnership. And different opcos within J&J have gotten better at it, and others have struggled. And it's a problem outside of Johnson & Johnson that I've seen, as well as this contextualized, empathetic innovation. So it's even Tetsuya, like I connected with Terry at one point. Terry's in the US from Metacroid, and he's talked about some of the challenges of the Hinatoli robot's fantastic in Japan. And then there's different things that are value drivers in Japan that when you bring it into a US context, it's a barrier for entry. And just how do we contextualize from Japan into a European or a US context and back and forth, and that adds cost and complexity. But in order to win all these markets, that's an area you have to navigate. And it also increases testing burden and cost for developing the solutions. But it's an area I love. I love that complexity in those spaces and what you prioritize. But yeah, I think Japan could be a release one market for certain medtech innovations, folks that are willing to consider it. But it's not the traditional pathway that's been done historically.
So the surgical robots available in Japan right now is Intuitive's Da Vinci, Hinatori. Anything else?
Senhance.
Is Hugo out yet?
Yeah, Hugo. Yeah,
Hugo is out.
Like a 30 system or 40 system already there. And Intuitive with like 800, and like we had like a 110, and so like a really competitive, but like a really not MicroPort yet, and soon I think so. And CMR not, and like I think the kind of one other Japanese company.
There's a company which is doing open microsurgery like MMI, which is called FMed. There's a company called FMed.
Yeah. I saw them at MedTech World. Yeah, you were there, Steve. Yeah, MedTech World in Malta earlier in the year. Very, very cool tech.
So this is so interesting how this is all unfolding already. Before we jump into some commercialization strategies and wisdom, because you have so much more than me in these spaces, within your current context where you're working, like what are you doing and what do you enjoy about it? What are you excited about? So you could brag on your company and your technology a little bit for folks that don't know. And Steve, you can't really share exactly what you do with stealth startups, but share what you're excited about.
Okay, I can kick off. So this is my 4th robot that I've commercialized or brought to market, and the reason for that is I've always gravitated towards new tech and stuff. So robot seems to be the way forward, and robot is basically an enabler. It's about the software and putting more capability in the hands of the surgeon, right? So I'm super excited about the digitization, how AI is going to come in once these platforms are in. And, something that Steve also talks about many times is that surgical robotics are very underpenetrated in the marketplace, right? Depending on how you measure it, is it 3%, 5%, or is it 20% of the available market, right? So, Steve, I do listen to you when you bring this. And I think I am a strong believer that manual surgery will become obsolete. It will be the minority of procedures done, and that surgeons of the future, just like pilots today, will be using robots and software to enable them to enhance better accuracy and lower blood loss and better patient outcomes. So that's the passion that drives me every day, that, you know, when I'm in the retirement home and I need something done, that, you know, surgery won't be like it is today, right? It will be so much more advanced. That's what I'm aiming for. So maybe
And
we
is
could, yeah.
and is there anything specific around Tumai and where you play in those spaces? And actually, with your role shift, I don't know if you're covering more than Tumai now as well.
Yeah, I think the robotic space is very rapidly moving from a couple of very strong players to a multiple, you know, environment where, and it's following Rogers' curve, you know, exactly, right? So more players are coming in. The market is expanding very rapidly. There's specialization occurring in different areas, and robotics are starting to appear in other areas. So I think, you know, and with that, costs are going to come down, right? As competition increases, we're going to see shakeout. You know, not everyone's going to survive this period, which probably makes it one of the most exciting periods of robotics that there's been. And that's what I'm excited about. I'm excited about how MicroPort and MedBot plays in this field, what technology we can bring in this area. The fact that we're, you know, med device has been dominated by American companies. Like, you know, they recently had MedTech Europe here it was in Stockholm, and it's all US companies, right? Apart from, you know, Siemens and a Philips sitting around the table. So the fact that there's more players coming from Asia into the market, I find that super exciting and super interesting to see how that's going to evolve, because there's a different mindset in how they develop and drive product innovation. So I think with MicroPort, we're going to drive innovation, we're going to bring costs down, and we're going to make sure that, you know, there's a robot everywhere, right, in the world. Right? So if you look at some of the countries that we announce, we have robots. It's a lot of developing nations, right? India, Pakistan, Southeast Asian countries, African countries. These have not been traditional markets up until the last couple of years. And I find that super exciting.
Yeah. And you're also pushing telesurgery pretty heavily as well.
Yes.
How many have you done?
We've done, as a company, over 750, right? So, and then we were doing one this week in Sweden. And it's fascinating, the application of this, because there's, you know, there's hospital building to hospital building, there's city to city, there's country to country, you know, and there's continent to continent, right? And they all have different features and different benefits. And there's methodology also. You can use standard Wi-Fi, you can use light cables, and low orbiting satellites is now becoming a technology for us to explore. So I think we're going to reach very rapidly a situation where there isn't going to be anyone in the world who will not have access to top tier surgery as long as they can get to a surgical robot. And it doesn't matter where in the world potentially the surgeon is, you know, it could be done, right? And you could be in a situation where, let's say, for example, you need a procedure that involves your liver and your gut, right? So the general surgeon can take care of your gut, but often you have a liver specialist come in and take care of your liver. Now those two surgeons don't need to be in the same building, right? They can tag team off each other and they can be in another place. And I think the opportunities and the possibilities of that is going to become very interesting and very, very important across the world, right? So that really excites me. And then, of course, you remember the two astronauts that went up into space a couple of years ago, and they were only supposed to go up for a week, and then there was an issue with their spacecraft, and they couldn't land.
Yeah.
They were in space for a year, right? Now, what if one of them had developed an appendicitis? That's a death sentence, right? So underground, underwater, into space, it's all coming, right? So when your kids are living on Mars, we'll be able to do surgery on them from here. Okay.
Oh my, that's so cool. I'm curious what the latency would be for that. But it'll be a little
well, they have showed it. To be fair, Virtual Incision did do
Yes.
to the space station, the ISS.
Yeah.
They did an actual demonstration from Earth to the ISS. I think the latency was a little bit of an issue, but it's doable. I think, Cash, you're right. I don't think we thought 10 years ago. I don't think we were thinking what there is already today. I think in another 10 years, it's going to probably surpass us all as well. A little bit of what we're thinking.
Yeah.
Okay. Realize.
Yeah, when Jacques Moresco did the first telesurgery case, 26, 27 years ago, from France, from the New York back to France. I mean, they basically they dedicated the whole internet traffic just for him to do that case, right, on the Zeus robot. No, they shut down everything else. It was, and now we can do telesurgery at a conference from Europe to China with everybody else on their computers and their phones using the same line. And so, yeah, Steve's right. We couldn't dream about what we can do today and in 10 years' time. Yeah. And that's where the Asian players, because they're so fast at developing stuff, right? Tetsuya, in Japan, you guys also develop stuff pretty fast and high quality.
It was. So I just want to say, now really China is really much more fast. I consider let's say really back to 30 years ago, really Japanese car really not available in Europe, America, and they consider okay maybe quality is bad, but not that way. Really quality is good, but so fast to penetrate. But really Japan a little bit decrease speed, and China is much more fast. That's why I can say really starting from topics about why really what is the kind of our intention behind what's kind of my passion to this Hinotori system. So first of all, Japan has a very few treatment company. Let's say Olympus and Thermo. This is a treatment company, but majority let's say diagnostic company. This is really to a Japanese company's mentality. They are always want to have a safety margin. Diagnostic is a bit safer margin things. Let's say really away from a patient life. But that's why really many company former time tried a surgical robot Hitachi or many company, but they are really stop the project because if something happen, really their consumer product to be damaged. So that's why really this is really criteria Japanese company. Okay, we can just satisfy in diagnostic, but we consider we had a technology, but why not to challenge this area? So I really want to change this kind of Japanese company, Japanese really possibility to be a Europe side and American side. We can do a treatment. We can save the patient life. So I really want to show this direction. That's a really first intention behind. And so I really love Kashif's story. That's a really good point. And we are really similar point. And so really robot is really now really good moment. Really maybe in the future really decrease price as well. But we had many possibility remote surgery and really ISS or Mars or somewhere to remote surgery as well. This is really transition time for surgical robot. So that's why I am so happy to be here. And so for my retirement, a little bit more time, but I also can get something kind of this is really one of the historical things I really want to let's say my step in let's say I want to make a history things. So that's the thing. And then remote surgery we are also doing. And the former time last year we did remote surgery test France and Japan, and let's say 23,000 kilometer and almost kind of half of Earth. And we really consider same as Kashif, really see the possibility and opportunity. So remote surgery can save many people's life. Also, I am considering this is really excellent tool for training. So sometimes really remote communication is possible, but on the other hand, remote communication is just communication. if like a remote control, remote surgery, things, it's so like really much more better solution, better like a training. So like a skilled surgeon can show, okay, like this way. Then like a kind of beginner surgeon can follow this way. So like a really good tool. So that's why like we are like really in pipeline remote surgery as well. And then, so our unique point is that like a more like not only focus on surgical robot area, but also for like a logistics, like a robot or like a drone helicopter, like a connect to hospital. This is the kind of way it can be utilized by like a Kawasaki technology. Kawasaki has a mobility company. So like a Medtronic, Johnson & Johnson are like a giant, like a MicroPort, also giant, intuitive giant. But like we are totally different way to do, like kind of we are mobility company. We can provide like healthcare mobility another way around. Hinotori is a one mobility tool to support OR. But like as a solution we can provide to increase efficiency of operation of hospital. That's like our intention behind it.
And Tetsuya, for the Kawasaki Innovation Center, because I know you just took on that role pretty recently. What's the mission and vision for that concerning partnerships and development of solutions in healthcare?
That's like a really I really love this question actually. And also connect to Steve's like a blog all the time. AI is like a really important topics, and Kawasaki Innovation Center like really focus on AI development. And the Kawasaki newly established last week, I think, like a physical AI center in San Jose we established in America, San Jose. This is like a cooperation with NVIDIA, and we are like really focused on something like AI technology to implement to OR solution. And I saw Steve's blog something kind of a couple of weeks ago. Something kind of AI is like really not like a replace people's work. Like AI should be enhance like a surgeon skill, and like AI should take over the work which human not possible to do. So something kind of AI should be like a more like a really extend like a technology. So like we are like really considering to implement this AI technology to develop in Strasbourg office. That's why like we are hiring many engineer, and we are like inviting many business partner for related to AI technology globally, and like really connect to this San Jose office, connect to NVIDIA as well. So like something like really make a new value for AI surgical area. So that's like our intention behind for Strasbourg office.
Oh, that's beautiful. And Steve, I'm going to split the question for you a little bit because you have so much legacy with CMR. So I'm curious if you could brag a little bit on where CMR is and where they're going, but then also what you can share about the future of physical AI and surgery holistically, because you have touch points with everything.
Yeah.
Everything goes through Steve.
Not everything, but not everything quite. But so I think from CMR, I think they're in a good place. I think they've done a lot to get their system very stable, and they've done a lot of improvements. And I think what was very interesting about that was that I think going to the US, knowing that you're going to the US, makes you sharpen your pencil. You know that is the Badlands of intuitive. You are going really into the Badlands there. So I think I've spoke with some of the people at CMR, and I think they've got a good plan for the US. And I think that it's a great alternative system. And I think they've got it in a shape now with the Versus Plus, which is like the second version. That was the version that I was launching just as I left there. I think that is a really good set of upgrades for them. So, again, I wish all the companies well. I want this to be a vibrant, active, multi-robot, multi-choice for everybody, where I like this for this and I like this for this. And again, I think it's important. The second part of the question, which is about AI, I think it's come faster than I first expected. And I think it's going to be used in ways that we haven't quite understood yet. I think some of it is going to be on the whole thing around training. But I think what's also going to happen is people need to start thinking about the step way. So there's automatic steps, then chains of automatic things, then autonomous steps, then chains into autonomous parts of procedure. I think we're going to be a long way before, the surgeon sits there, presses button green, the robot does the thing, and when it's finished, presses button red. I think that's a long way away because surgery is very nuanced. But I don't think it's impossible, by the way. Some of the stuff that I've seen in the last year makes me think it's not impossible, but it may not be the right practical way. But what I think will happen is that there'll be the assistive steps where it really helps to compress the bell curve. So if you think about skills in surgeons, although most surgeons think they're all in the top 1%, and no offense to my surgeon friends out there, but most of them think they're in the top 1%. There's actually a bell curve of distribution. And the problem with surgery is it's not an even bell curve. And if you look, there's a long tail to one side. And it's that long tail that causes all the complications and all the problems. And that's from two things. One is from making bad surgical decisions. And the second is inability manually to be able to do the things that they need to do. They don't have the manual dexterity or the experience. And that long tail causes a lot of the cost in healthcare and a lot of the problems. And I think where AI and robotics starts to help is it's not about making the better people better. I don't think that helps us, But what I think it does, it cuts that tail off. It lifts the bottom 25% and brings them towards the middle. And if we do that, I think that for me is the exciting thing of what AI and autonomy and autonomous steps can do, is to give that assistive steps. And I liken it very much to driving, which is if you're a junior driver, you should have every assistive thing that you can have. You should have parking sensors. You should have parking assist. You should have brake assist. You should have, lane assist. All these things. Now, when you get to, you've been driving a long time, you may not need them and you can dial them down. But I think we will impact the new surgeons and the less capable surgeons disproportionately. And I think that will be a thing that will really change healthcare. And you need a robot to do that.
Yeah. I totally agree with that. And I saw that when I was working on Corindus, right? So Corindus was a cardiac robot that enabled cardiologists to get stents into hearts and through branches. And what they did was they took the skills of some of the top surgeons not top cardiologists in America, and they trained the robot to be able to do the same thing, to get through torturous. And then that came with the system. So all of a sudden you had skills of the top 5% of cardiologists at your fingertips. And you could see the finding of vessels, getting through tortuous gaps just at a press of a button. So that did exactly what Steve is saying. It shortened that tail, right? By giving them that ability. So definitely that's going to be very much part of what AI and this technology is going to bring. You've got to see what value can we bring by sticking a computer between a patient and a surgeon, or a patient and a clinician.
I'll add in there I think for me, one of the most important things, when people say to me, well, you could do this with guidance on a laparoscopic screen. And for a long time, I've said, no, there's a difference. So what you have to remember is that with the robot, and for your listeners who may be not too sure, you're not physically connected in the sense there's no physical manual connection between your controllers and what the instruments do. There's a computer, there's an input, and there's an output to the robot. And the important thing is that in laparoscopy, I can be stood there and a warning comes on the screen. Nothing stops me and I can continue. Once you put a computer in the middle, what you can do as the AI gets smarter is to say, whoa, hey, doc, and it can disconnect you. You can move your hands all you want. It's going to stop. And it's going to say, danger, do you want to continue? In laparoscopy, you just continue. In robotics, you're going to have to say, okay, press a button to re-engage. And I think that psychological difference between the two things will be the thing that will really bring safety in.
Yeah, but that's a really nice a point. I really like these things, and I really like really this approach, like Kashif and Steve mentioned, that like really things like let's say like a standardized, like really quality, like really shifting, like really next level, like entire things, not like really just kind of like a skilled surgeon to like increase more. No, like kind of like other like really surgeons level, like really skilled up, and like connecting like a robot, like really much more capability to have a support, like a really cut out, like a really if like something case danger, it's so like really possible to disconnect and like a really much more like a really safer layer there. So this is like a really significant change and like a really integrate like AI. That's like a really many possibility there. Yeah, that's like really agree on.
And I
Yeah.
think one of the, and this will kind of be a fun pivot into commercialization. Like one of the challenges we consistently navigated in Ethicon in our handheld business was you get to the top of the S curve where it costs too much money to provide another layer of feature and still being able to demand a premium in the market. As we have more competitors coming in, establishing what are table stakes for these different robotic AI solutions and what is premium and how you charge and get reimbursement for it across a global context is becoming more nuanced and possibly less profitable, or depends on the scale of that impact. Like, is you the way that I like to break up marketing and commercialization from my own simple brain, it's like there's downstream marketing, go to market strategy, like what you're deploying out into the field, and then there's upstream of your proximal with clinicians, you're sizing up potential opportunities and you're trying to drive either biz dev activities for acquisitions or front end R&D to internally develop new tech. From an upstream perspective, how do you kind of filter for those shifts and determine what technology should you deploy in a given context? Whether you're talking to a simple robot that solves one problem, or we have more complex architectures that are coming out with the full body robots, orthopedics. What are some of your best practices of understanding clinical unmet needs, understanding market opportunities, and then figuring out how to put the right pressure on the engineers and the technical organizations to reach that target? And then we'll go into the downstream commercialization. So any case studies from your journey?
I think from my side, when you're on this journey, and I've been on a couple of products like this, the eventual market has to be able to support what you're developing, right? There has to be enough business there that can not just repay the R&D investment that's been made, but it can make a profit on it, right? There's otherwise what you're doing is a science project, right? It's not a business, right? And Steve made this point to a bunch of entrepreneurs recently. When I had the privilege of sitting in on it, that if there isn't, the first thing you got to look at, you may have a great idea, and you've developed something great. Maybe it's come out of a university project, or it's come out of your garage at home. But if there's no sizable market for you to go after, and potentially at least a reimbursement code in most of the developed countries, then you have a nice product, but you don't have a business, right? So I think that's step one for me.
And for first movers in a space where you have to do policy shaping to adjust reimbursements, like how do you take that risk versus being a close follower from a larger player? Because sometimes you are shaping solutions that don't have reimbursement. That's how
I can jump in on that a little bit.
Yeah.
There's a really good picture that I saw the other day, and so a lot of startups can't be the first, or try and be the first mover and can't be. So there was a great picture I saw the other day, which was a mouse trap with a dead mouse in it and a second mouse next to it eating the cheese, and it said, "Often the second mouse gets the cheese." And I thought that summed up beautifully.
Brilliant.
Yeah, I think it sums up beautifully what happens if you're a startup and you try and do that whole policy shift. The idea is right, but the mountain you have to move to change reimbursement codes. I mean, in Japan, if you wanted to change reimbursement in Japan, it's a huge, governmental level work to be able to change these things. So I think, I think one of the problems is, unless you are a big company, maybe you shouldn't go after things that don't have an ability and willingness to pay. I think it's noble to go after them, but a lot of people don't understand the time, effort, and money that's required to actually make it happen.
Yeah, 100%. I mean, I've often said in meetings, first mover advantage doesn't exist in medtech, right? It's, as Steve said, it's something that's taught at every business school, but medtech has hundreds of examples of companies that moved first and didn't make it, right? And their second and third followers did, right? And reimbursement is an interesting one, because if there isn't a reimbursement code, if there's no way for the hospital to be able to purchase your product, is basically what I'm saying, that either an insurance company has a payment code or the government has a payment code, then good luck. I mean, I can count on one hand where new reimbursement codes have been created in my experience, right? Getting the government to pay for something. I think if you're thinking, right, we'll launch this product and it's going to be so great, and the governments of Germany and France and Italy are going to create a new code for me and they're going to pay through that code. Yeah. No, I've never, very rarely seen that. And it's a long road, right?
Yeah.
And is that going to change in the short term? I don't think so, right? And I think about AI, how is AI going to be reimbursed in the future, right? It will have to be part of another solution which already has a reimbursement, right? So it's a fascinating area of discussion. Tetsuya, what's your thoughts on that?
That's like a really big point, like AI, like a really new technology, like a really new code to like a pop up, like a really, let's say like almost not say like 0%, but like very hard. And like so much lobbying activity, so much time to spend. And during the time, like really technology are already like really not like a new. So that's why like I think like this is like a really tough thing. So many companies like really consider, like Kashif mentioned, like something institute or like a university, like really pop up, like really excellent technology. Then like people consider, like we can be like really a new technology to penetrate like really cash cow. No, actually not. Like really, we need to consider first reimbursement, or like using like current reimbursement, or if like a really certain reason to pop up, like to create new reimbursement things. If so, which country are like a really easier way to do, or something kind of like a really like these topics are like really connect to like an entire go-to-market strategy things. But I want to say these things, like many companies are like really not consider like a first stage, just focus on development. But like for medical device business, like necessary to start from like this reimbursement topics, then like really down to like a really technology like a development side. So that's like a really correct way to do. But still like many company are technology driven things. So I really want to change this like a mentality things. But like I said too much this point. If so, like Japanese people hate me again. So that's why I always like, try to be quiet. Yeah. You should proud of the Japanese technology. Yeah. I'm proud, but like this is a business I want to say. So that people hate it. So,
Japanese most hated.
Yes.
But you said one thing there, Tetsuya, which is really, really important. If you start with technology and then try and find the clinical need, it rarely goes well. And I think, one of the question that you asked was, what's the experience of where you, or what's your advice? The upstream marketing people, the strategic marketing people, and the engineers need to go and live in the operating room, or the cath lab, or the radiology lab, whichever product you're making. They must go and share the pain that the hospitals, the nurses, the clinicians, the finance people are suffering within the hospital.
Yeah.
At that point, then you don't just see it with your own eyes. You say you feel it on your own skin. The problems, because ultimately, what we need to be doing as an industry is not creating technology for technology's sake. We need to be finding where is healthcare suffering today, and as demographics change and as funding changes and as technology changes, where is it going to suffer tomorrow? And where can we stop the pain points? I think if you start from that side of things, instead of, I've got this great technology, let me find something that it can go and fix. I think that's probably the biggest advice that I would give to the upstream marketing and the engineers. Get into the physicians and the hospitals and the payers' place and live there for a while.
Yeah.
Absolutely.
Yeah.
Yeah.
If you're dreaming that your new idea, your new technology is gonna cure cancer, but it's gonna cost an absolute fortune, but don't worry, governments of the world are gonna pay for it. You need to reevaluate. That's not how it works, right? Governments have a finite amount of money that they're going to spend on healthcare, and that healthcare bill in most countries of the world is escalating as the population gets older and in some cases sicker, right? The mental health bill has increased massively in a lot of Western countries. So there is a small pot of money that you can go after, and when your specific technology can be very small. So I've had a similar experience in one company I was in. I was talking to one of the engineers, and I said to him, you know when you're in the OR and he said, let me stop you there. I said, okay. He said, I've never been in an OR. I was like, then how are you developing this product for an OR if you've never been in an OR, right? So I said, that's the first thing we need to fix. You need to come with me to the OR.
Yeah.
And then the problem I had was he said, yeah, but what about the other 60 engineers that are in the company? I was like, right. How do I get the other 60 engineers to be inside an OR to feel that environment, to understand what that's like, right? It's really a privilege to be in an OR, but they don't like it when there's 5 people visiting, let alone 60.
Yeah.
The infection risk is off the scale.
Really increase the risk. So that's like really not like invite. So that's why like let's say like two like really one by one to invite to OR. So like this is like exact like same experience like as I mentioned like I attend like many case like 200 case like in Kobe University, but like when I address to explain to engineer, they don't understand the OR field. They are like really have to focus on like really technology things. Some people like really don't want to go like a real environment. Some people like really like to like build something. So like we need to select people's mentality. Okay, the guy like can be like understand. Then like pick up people and like really send it to OR and like really they like a feeling and like they like penetrate the other engineer. So like I really took the time such a kind of structure almost kind of 3 years to spend. So that's like a really tough work. And like people consider like really, like we had a technology, we don't care, like just a kind of one new solution to add. Definitely not. So like such a mentality to change like really necessary. And that's why like really like what's like a really pain point in OR and how we fix. That's a kind of starting point. That's like a really totally.
Yeah.
And I think on the top of that as well, the other thing is when you are in the OR or when your team are there, you need professionals who know to ask the right questions. So the worst question is, doctor, what do you want? Okay, that's the worst question ever. Yeah, well, most of them are frustrated engineers, right? So they'll give you their design immediately and the way they're going to fix it. And a simple thing that I used to work with all my teams on was don't ask them what they want. Ask them what's painful. What's sort of needed here. And again, if you get that right and you've got the right strategic marketeers, they should be like a Rosetta Stone. They should be able to take one language and turn it into another. Engineers work in very precise language, often not in a clinical language. And a great strategic marketeer can go in and hear the clinical need, the clinical problem, and can convert that to the engineers and say, this is what they're struggling with, and talk in a more engineering-like way. And I think when you've got a team that works that way, you see much better results and better products, faster products.
That's like a really totally agree. Like we always like say like what like a clinical anchor. So something kind of try to clarify clinical anchor, but like don't ask kind of surgeon like really directly what do you want. So like this is like a really silly question, and we need to clarify ourselves like a really attending like a case observation time, and like that's why like we need to understand anatomy like a clinical procedure. Then like we can recognize and maybe like a surgeon struggle to do this like kind of find like this aorta or something. If so, what kind of suggestion we can do? Then like really consider then like this wording like to transfer to engineering specification. Then like start to have like a development. So like this like a process is like really difficult to build up. From like a new company things. That's why like I say like really such a way like I took 3 years but like really not perfectly to a situation at this moment but like this process is like a fundamental like approach like a correct approach and I really like Steve's comment what do you want like such a question still some people are asking then like a kind of like a surgeon like easier to piss off so like I am like
You know,
unhappy in front of the
it
situation.
reminds me of, you know, when Sony launched the Walkman, right? Remember they I think they did 3 market studies, and the CEO of Sony said, well, let's just make this portable, you know, music device. And
Mm,
3 studies came back and said, yeah, the market doesn't want it, right? Sometimes the customer doesn't know what they want, right? Because he said, I want it, so make it for me. I want to listen to classical opera music while I'm running, so make it for
mm,
me. And then that, you know, and now we have iPod and iPhones because of that journey. Sometimes the customer doesn't know what they want, right? And really fascinating process is to look at the patient journey. So take a patient with a particular condition, you know, their journey through the hospital from diagnosis to referral to coming into the hospital through the
mm,
procedure and out the other end, and then look at all the pain points, all the things that are difficult, all the areas that could do with a better solution than what we currently have now, right? And that's, you know, could be a really good starting point to have a number of products that you think, okay, there's a number of pain points here that we could look at solutions, and then you have to analyze, well, which of these pain points is somebody
mm.
willing to pay for? Is there a market
Uh,
that exists for this, right? And I've seen that process being done, and in a surgical case, which could be a great way to come up with new products.
And I think to
Mm.
build on that and then
Mm.
to pivot, during my time in Japan, I had the opportunity to attend a whole bunch of case observations with interventional bronchoscopists. In Japan, it's like the top skill set globally of their ability to reach small lesions through the lungs with the bronchoscope. And a lot of their challenges and you know, what do you want? Those kinds of questions was they want a robotic solution that doesn't require anesthesia because that's what exists on the market in the US context. And I didn't really grasp that. The US team didn't really understand that. But when I was in the bronchoscope like suite and seeing patients walk in on their own feet, sit down, be put under light anesthesia for a moment, get biopsied, sit back up, cough up a little bit of blood in some cases, kind of come to, and then leave and see how many people they cycle through that room. I was like, oh, what we've developed with Monarch, for instance, doesn't meet the needs of this market based on how the system is in your body and the way that they have to be fully put under. I think there's just immersions that create that empathy. That proximity drives empathy so that you can innovate more intentionally.
Mm.
When I worked in Otava and on handheld instruments, I attended one case over the course of 8.5 years as a design engineer, robotics controls engineer, systems engineer. Like I owned risks and requirement cascades from clinical risks for a portfolio of instruments on Otava. And I had seen one robotic hysterectomy in Ohio. So it's a common cancer
Yeah.
within our organizations as engineers to just be disconnected from the needs of the clinicians. And when I did my first case observation in Fukuoka in Japan, I was with like a top tier marketer sales rep who'd been with J&J for my whole lifetime, basically. I just asked him, like, how many cases have you seen over the course of your career? And he's like, easily like 3,000. And I'd seen one. And I asked, like, do you still learn something? It's like every single time. I learn something from these clinicians. So that led to this vision of Sanbyaku Shujutsu vision, which just means 300 surgeries. Of how do I get up to 300 reps? I made it to 45 before my job was impacted, and I reset and did entrepreneurship. But it's just having that strategic focus on getting proximal to clinicians and patients, I think is necessary if you're progressing these solutions. The pivot, because I realize we have like 30-ish minutes. I mean, I could stay forever and chat with all of you, but you can't because you're busy.
Yeah, getting us to stop talking is going to be a problem, my friend.
The pivot, I want to lay out a very kind of quick case study. So we've done the upstream side a little bit with the focus on immersion. If we look at neurovascular robotics,
Right.
1 in 6 people will experience a stroke over the course of their life. I have 4 children. So that was a statistic that was actually very shocking to me because I've never been proximal to strokes. And your clinical outcomes are often dependent on your zip code or where you live relative to centralized cities. So this goes back to telehealth as well. I have family members that are 2 hours outside of Nashville, which is a large city. They're in a very rural community. If my mother gets a stroke, the likelihood of her either being permanently disabled or dying is much higher than my proximity to Chicago right now. One company that's progressing some really great solutions in this space is XCath, but there are multiple. Siemens Healthineers has a build-to-buy partnership with Stryker. MicroPort has a solution, which is a disposable robotic catheter. Is my understanding.
Nanoflex.
Yeah.
Nanoflex out of
Nanoflex is
Zurich.
in there.
Yeah.
There's quite a few progressing different tech. I want to leverage. Go ahead. You can cut in. Go ahead.
Are you saying that your 4 kids are going to give you a stroke? Am I reading? Am I reading you right? Like maybe 4 kids might have been a mountain too high to climb, right?
It's fun. I hope they keep me younger than older, but we'll see. I don't have gray yet, but my wife does. So, so the question I have is, if we pretend for a minute that you were all chief commercial officers of XCath, because it's a different robotic context. They've done first in human successfully. They've also done, I think, first in human telesurgery for stroke care. But it's similar to other conversations we had. It's a very complex environment concerning reimbursement, how you create a hub and spoke ecosystem where you have these clinicians that could do care on the outskirts, who's navigating the risks if something occurs in telesurgery because you don't have trained expertise proximal to those areas of need. And you have a aggressively growing competitive landscape of undisclosed solutions. So if you were championing XCath, like how do you play in that environment? What are you prioritizing from a go-to-market strategy? Which KOLs are you engaging? How are you leveraging the ethicon historical approach of building out institutes to teach in these spaces? Like, because you have to educate, advocate, and also potentially lobby or shift policy to open up reimbursement and the potential financial impact of solutions like this. But stroke has a massive impact on GDP concerning like maintaining the disability beyond those incidents. So if you could diagnose more quickly, intervene more quickly, there's a huge healthcare economics benefit to a solution like this, but the ecosystem's not fully there. So I'll just create space and then we'll end with some lingering questions, but I don't know who's excited to lean into that. Congrats on your promotion.
Yeah. Go on, Steve, you go first.
So, hey, friend, I hope you're enjoying the show, and I apologize for interrupting, but I want to share a couple quick actions you can take because I know you might be busy, you might be cooking dinner or driving, and if you don't make it to the very end of the show, I don't want you to miss out on some great ways to connect with these wonderful members of this episode. And I'd encourage you to pause everything and just do the follow-up, because I know if something takes less than 5 minutes and I don't do it, I never do it. So first of which, I encourage you to connect with Steve, Tetsuya, and Kashif on LinkedIn. They're all fantastic content creators. They have their own style and they're all progressing different narratives in medtech. And they're on my feed all the time. And I glean something from them just about every day, which is fantastic. Number two, if you're curious about Moonlight Medical and different ways I could support you triangulating your clinical unmet needs, technical feasibility, and commercial viability, or helping with brand presence if you're trying to do a large raise or create a bidding war or attracting talent, I would love to just explore what your unique needs are. You might be a stealth mode startup that's looking for this capabilities that me and my team have, Or you might be in a large strategic trying to do some front end work, some competitive analysis, or maybe you're navigating the make versus buy decisions that often occur in business development. Happy to consult in those spaces as well. Number 3, if you enjoy this show, I would encourage you to be a guest. Check out the Sunday Sips Waitlist. This is a monetized service I provide. I work really hard on these episodes. They're a lot of fun, and I could either fly out and do things in person if you have some tech you want to demonstrate to the world, or I can do them remote like I did on this episode. I'd also encourage you, if you have a friend that you think would be a great guest, feel free to fill out my waitlist on behalf of them, which is super helpful. And at the end of the waitlist, there's a discovery call link if you have some clarifying questions around the value that doing content creation like this could bring to you from a personal brand or from a corporate brand perspective. Number 4, if you are looking for a community, and even if you're not, I would highly encourage you to check out the 2 communities I'm building on Skool. I've put a lot of work into these, and I found that early in my entrepreneurial journey, especially in Japan, I hit 0 to foreign country because I wasn't surrounded by folks that were a step or 2 ahead of me in a given capacity, and I just didn't know a lot when I jumped out from the corporate world into the business building world. So the 2 companies, the 2 communities I have, the first is the Big Brain Club, where I help folks build the lives they desire, living where they want, loving what they do, and being paid well for it. A lot of folks have these big dreams of, I wish I could live in this country, or I wish I could have this kind of job, or I've always wanted to start a business. But then in 5 to 10 years, their life will likely look the same as it does right now, because there's a lot of shifts in inward work that hasn't occurred. So I help people with that. And as well as just action, create an urgency to get stuff done. And then the second community I have is Skool MedTech, where I'm triangulating patients, clinicians, and innovators, bringing them all into one space so that patients can share their stories, navigating different healthcare challenges or being a caretaker for others. Clinicians can share their unmet needs that they face in the OR. And then I want to bring innovators into proximity with those stories and those unmet needs so they can actually progress meaningful innovation on their behalf. This is a project I'm bringing multiple members of Moonlight Medical into. I'm excited to build this large repository of unmet needs that you can ideate on. And we can see what progresses either in large strategics, spins out as startups, or goes into academic spaces, which should be a lot of fun. Number 5, I'd encourage you to check out the deep dive episode of this, which is called Second Sips. There are so many thoughts I had during this discussion that I could not share because I needed to create space for these 3 titans. So I go deep in the episode, I pause through multiple highlights I have, and I sketch stuff up and I nerd out on it. So if you really want to drill into the details of this and kind of pick my brain on what I was thinking during this, that's going to be a wonderful episode for you to watch next. Or you can check out the Legacy Sunday Sips episodes, all of which are in the description. I've had incredible guests. Steve Bell has done quite a few episodes with me. I'd highly suggest the episode on physical AI with Santosh Iyer, episode on reverence for the craft with Ian McCathern, who was like the big brain that he did 1,000 part files have his name on him or has his name on them from Maestro. Like, just an awesome conversation we curated. And maybe there's also one that I did with Vessel Prosthetics, the CEO of that, Sydney Robinson, was really interesting as well. So I encourage you to check that out. And then finally, and this is probably the most important, just take 20 seconds, take the link from this conversation and send it to one friend who you think would get a lot of value from it. While I love putting out content out into the algorithm to carry it, it's really cool when these kinds of conversations pass from word of friend referrals, because you're likely working with someone who would get a ton of value out of this dialogue. And when it comes from you, it's that much more meaningful to them and they can prioritize it, and it helps the show grow. So yeah, you can do all the like and subscribe and all that kind of nonsense, but really it's forwarding along and saying, hey, I think you should watch this because that's what makes the work that I do flourish and prosper. It's all because of you. So appreciate you. Keep changing the world. Back to the show.
So I think the first thing is that for some of those robots in stroke thrombectomy, at the minute, it's still very early days.
Yep.
I think what we have to do is, again, you have to have good, solid evidence. And this is all going to be about health economics. This is going to be about, you have to prove the health economics. You have to prove that the robot works as safe and effectively as a standard intervention. The next thing you have to then do is prove that that translates to a robotic intervention. And the reason why that's a little bit more challenging is that The interventions, if you look at how and where they happen, is in a lab which is fairly specialized with fairly specialized staff. And that's in the hub, at the center of the hub. When you go out to the spoke at the distance, there often would be rural hospitals that have low numbers of interventions and may see 2 of those a month, maybe. So the other thing you have to do is prove that at distance, in lower volumes, that the support staff can make sure that it works safely and effectively as well, which I believe it will. But I think you're going to have to prove this stepwise. And then what you're going to have to do is rapidly show the economics and show either theoretically and then with proof that if you take a patient and you don't helicopter them 2 hours, the difference of that is massive. If you reduce your long-term requirements of physiotherapy, physical therapy, speech therapy, and those, you'll prove that. That's going to be hard to show because it's longitudinal. You have to show it. But I think there's things that you can show that are in there that will immediately, the transport alone, I know, is a huge, vast burden on the insurers. But I think the first thing you have to do is prove it's safe, effective locally, safe, effective at distance, and then start to work out the health economics before you go mass appeal. I'll start there.
Yeah. I think this is it's a good market because typically neuro interventions like that are well reimbursed, right? So going back to our point in reimbursement, coils and stents, etc., for the brain are well reimbursed, right? That is good. I agree with Steve. I think time is brain, is what they say. When you have a stroke, every minute you're losing X number of thousands of brain cells. And right now we need to get that patient to a hospital, a specialized hospital, as Steve says, as soon as possible, right? What if we turned that on its head and said, we'll get the equipment to the patient, right? So we can put this in maybe the ambulance turns up and it has the equipment in, which is challenging. As Steve says, it's specialist equipment with specialist people operating it, right? But you have in a lot of countries, specific stroke type protocols for this type of thing to get the patient to the hospital. I think where tele interventions come in is that if you could send the vehicle to the patient and the minute it gets to their house or wherever they are, you put them in the back and you can do an intervention and the doctor is still in the hospital and can do the intervention on them, that's going to be huge. And I think that's definitely one of the limiting factors there is the support technology, right? In that hospital, you have an X-ray system that can take pictures continuously so you can see what you're doing. You need to be able to make that portable, right? How do you make that portable inside the van? So that support equipment needs to be developed. And then that's the latency of the surgeon seeing where that catheter is putting the coil or the stent. He's seeing that in real time, right? Or she's seeing that in real time. It's not insurmountable. I mean, we have the technology to do it, but putting all that together is going to take a project of multiple companies and healthcare systems saying we want to do that. But the benefit at the end of it, I think the cost benefit ratio will pay off. As Steve said, the cost to GDP of stroke, is massive. And it's definitely a low hanging fruit for people to go after, I think.
Tetsuya, any wisdom?
Okay, that's a really good point. I really fully agreed on Steve and Kashif's comment, and maybe I can pop up another point how penetrate this system. So market introduction and cost affection are already mentioned, Steve and Kashif. That's why I just consider I had no clear idea yet, but maybe. This interventional robot system, maybe endoluminal robot as well, something kind of very different like a phase there compared with a soft tissue robot system. So that's why, so something kind of like a completely switch to robot is like really too fast to do. So something kind of like a really penetrate way is that like really how we convince physician to like introduce this robot system there. So something kind of, I have no clear idea, but maybe something kind of a hybrid idea is necessary. For example, endoluminal robot, like there are already like had some endoluminal robot, like a switch from like such a way to like completely to move to like a robot. Maybe this is like too fast to do. Maybe in between something kind of like a hybrid solution are necessary. Could be like an interventional robot as well, like a really former time, like really physicians, like a really skill, like really many things. And they are learning like mostly like 20 years, 30 years. And they are proud of this. If so, like really, let's say soft factor, they are like really sometimes don't want to accept a robot system because they are proud things. So that's why like something kind of like in between hybrid solution are necessary, but like really not exist hybrid solution. That's why like maybe some of like a really penetration are limit at this moment. Yeah, just like kind of my feeling. Yeah.
Interesting.
And luminal robots is also interesting, right? So for the uninitiated, so we're talking about, when we talk about endovascular, neurovascular robots, we're talking about robots that go into your veins and arteries, right? But endoluminal are those that are going through natural orifices and into, tubes that already exist inside your body, your stomach, your gut, your mouth, you go through your nose into your lungs, where you don't necessarily need to make a cut to enter the body. This is really an emerging area, and it's something that's come and gone, right? We've had notes in the past, which was like a manual tool, right? Yeah, notes that was natural orifice
transluminal endoscopic surgery.
Thank you. That was it. that was going to be, that was good, but it was manual, right? And it was manual systems, and they were huge. But now with the ability to have robotics, it's really developed really fast. So I think that's going to be a new area. And for me, the litmus test will be, what is the end user cost for a system like that compared to external robotics and non-robotic procedures? Yeah.
On the endovascular side, I had the pleasure to be at Sentante last week, which is the Lithuanian robot, which was really good. Yeah. So they got CE mark, by the way. They got CE mark last week as well. I happened to be there. So I think for the endovasculars, you also have to realize that one piece of it is the neurovascular, but there's also the cardiovascular, like was Corindus, and Siemens has switched now. Corindus is going to be for neurovascular as opposed to just the cardiac. And there's also the whole peripheral vascular, which is a huge market as well. So I think one of the other things on the endovascular robots that's important is it able to do all three of those areas so that you can have the volumes so that the daily use of it becomes a lot easier and it makes sense. You can't. The second thing as well is, and again, when you've been in general surgery robots, you don't want your first user using your Hinatori or your Tumai on an emergency case at 3 a.m. For a major case for emergency in the emergency room. You don't want that. That's not the best time to use it. Likewise with endovascular robots, the first time you use it, you probably don't want it to be on a stroke patient for thrombectomy. But you might want to do it on more of a scheduled peripheral vascular or a coronary procedure that's not so emergent. And again, I think what's going to be interesting is how these companies, and there's about 12 of them that are out there. There's Sentante, there's Nanoflex, there's Magnendo, there's Navigantis, there's Remedy Robotics, there's a whole bunch of them. It's going to be very interesting for me to see how they go after it first. Do they go after the neuro first like XCath? Or do they go after peripheral first, like Sentante? And I think it's going to be very interesting to see how those companies, which ones get the faster uptake. I think they'll all do all of the procedures eventually, but which one they will get the uptake in first. And and having done Corindus, Cash, you know, It's not
Yeah.
an easy sell.
It's not. And one thing that entrepreneurs working in areas like this have to be prepared for, if I say it kindly, it's like taking feedback. If I want to be unkind, I say be ready for an expert like Steve to come in and call your baby ugly, right? It makes no point to have someone like Steve come in as a consultant, look at your product, and start giving you where maybe your marketing is wrong, or maybe your product needs to be tweaked, and you go into defensive mode and start defending your piece of kit, because that's not helping you. Why did you call him in, right? So entrepreneurs in this area got to be ready to take feedback and pivot if they have to, right? For either technically reasons or market reasons. Very important.
So to add more layers to this, Kashif, you said like you have to create an ecosystem of technology across multiple partners with the X-ray and the robot navigation, the disposable. Steve, you talked about the time required to get the different clinical proof along that continuum. Like how do you position the mission and vision of the company and the commercial strategy to continue to raise enough capital to stay alive across that? Especially like if you don't have the right handshakes with other partners to deploy those other pieces of technology, like you have to go out and get buy-in from either large strategics or other startups and have everything move in parallel. I know XCath raised, I think 93 million is where they're at right now total, which is a pretty substantial raise. But like, how do you position that in this such a competitive landscape?
Steve, you're the expert at raising cash. Yeah,
Yeah,
you raised $1 billion, right?
Yeah, so I think the first thing I'd avoid at the minute is calling it a robot and going out and banging that it's a robot. I think you need to talk in therapies more than talking just the robot. I think you have to set people's minds in, a robot for a robot's sake it's not been great returns so far for the investors on the robots so far. So the first thing I would do is if I was going out there to raise money around one of these systems is I would be looking at the networking architecture. In fact, one of the things that I am working on at the minute is we're trying to run a consensus meeting at Orsi in January next year for endovascular and neurovascular robots. Because I think one of the other things, or one of the learnings that I would have from the time of Intuitive, in my opinion, it's just my humble opinion, is that you had one company trying to do it all and have it all. I think if all the companies get together and talk about this as being a therapeutic area we want to raise the game on, and then you can fight for your technology's space within it. But I think that I think general surgery robotics struggle because you only had one company trying to do the whole lift, and every other company was because they didn't have a robot was saying no. They were a lone voice. I think one thing that I would be doing is talking, and stroke is a great one. There should be no one on this planet that says we don't need to fix the problem with stroke. And then if 12 robots go there and say, we're all going to have different ways we approach this, but we all stand shoulder to shoulder and we get the voice and the message out that stroke needs treating. I think that helps the investor community. If you just go out and say, I've got the best robot in the world, I think that's a hard way to raise money today. I think what you've got to talk about is this is a sector that's going to be really impactful, and we've got a solution of many. But look, there's lots of other people trying to do this. You're not betting on some kind of lone wild card. So if I was going out there, I wouldn't want to be a lone wild card. And then it's great news, by the way, that Siemens, Stryker, with their Readiness platform, have really done that in the market, because what they've said is they've said that a strategic has agreed this is important. It's not madness. It's not some wild thing that's never going to happen. You've got two big, important strategics who know what they're doing, who are embarking on this. So again, I think all of this at the minute, I would be trying to get everyone together with one voice, and then show why your system is better.
Agreed. I think also, launching med device is hard. It's super hard. And because it's not like launching a new pair of jeans or something. You don't have to worry about regulatory bodies or reimbursements or any of that stuff, or doing a clinical study to prove that your pair of jeans is going to look good on someone, right? It's going to take time to get a product to market. It's going to take time. So what does that mean from the investor standpoint? You're going to need multiple investors over a number of time, right? And you may start with friends and family, angel investors. You may move to family house investors. At some point, strategics may jump in, and you may have to raise, right? And Steve's been through this process, but it's going to take a long time, right? And you got to be ready that there's going to be dilution of your share of the organization as you go out and get more and more money. But be prepared for the long term. This isn't you're going to get $1 million from a friend and you're going to launch a medical device next year. That's not going to happen, right? So be prepared for that long journey, and be prepared to be able to bring in bigger and bigger, more strategic, maybe more even aggressive investors as you go down this journey and get closer and closer to market.
Beautiful. Tetsuya, any lingering thoughts on this?
Yeah, yeah. No, like kind of, I totally agreed on like a really many like a really pain experiences, like a really same like a really long term like a really investment are really necessary, but like a really some of investors like really not understanding. Okay, like a robot is like a really pop up. If so, like a really refund like a next year, like some people like a really misunderstanding. So that's why like a really they are like so easy to be disappointed. Then they kind of move out the money, and some company bankrupt. Such a like a situation are really a lot. So like really people need to understand that such a kind of like a medical device business is like a really long-term journey things. Yeah.
Excellent. Well, I have one lingering question, and then I have to go in and actually parent my son. Got a text from my wife, so we got to wrap this up. So I want to kind of like one big brain idea that each of you have for someone who's been in commercial, like started as a sales rep, they have a heart to be in marketing, and maybe they just transitioned and they're doing their first go-to-market strategy for a medtech device. It doesn't have to be a complex robot, and maybe think like they're in a normal career path, like they're in a Medtronic, a J&J, nothing startup and fancy. What would be one big brain idea you would have for that person to kind of help accelerate their career and have a lasting impact in commercial strategy for medtech?
Well, I've been in this position, right? I think when you're launching a new product, launching products like this across regions, it's a team sport, right? You cannot do this on your own, right? And I think the first thing you got to go out there and go and find out the nuances in every market that you're in. Could be every country, could be every region. But go and talk to the people who are in the field, who are walking in and out of those hospitals every day. They're going to tell you what in your plan is going to work and what in your plan is not going to work, and how much investment is going to be needed. But you cannot develop this in your ivory tower and drop it on the countries and everyone's going to run with it, right? You need to get that buy-in from all your regions, tweak the strategy, tweak the go-to-market in every region, and get buy-in from each and every one of those people, or you're going to very quickly hit a wall. And I'm talking from experience, right? So that would be my big learning, is involve as many people as early as possible in the process.
This is like a really great point. Like I also like really see like a really many struggle things, and like really I really like this comment, like a really like a team sports, like a really not one shot things. Let's say like a really implementation specialist, like a really good. If so like a sell well, this is not gonna happen. So like a training, a service, and the implementation specialist, and like a background, like a many like a publication activity, they are clinical as well. Like really many people like really need to be involved, and many people need to be same page. So this is like really necessary to do. That's why I can say like really when launch the product and then expand like immediately is really not possible. could be possible, like a really big company are possible, but like a really surgical robot way is like really we need to set like a core hospital there. Then like we can like really go together with a team. Then like really make sure like really safety, like really learning well. Then like we can move on like a next step. Let's say like really unfortunately like one by one are really necessary, but like because of team sports, like almost kind of every people like need to be involved, especially for financing, like really necessary. Like so, like so much like a really big matter, and some hospital don't want to pay like a really big capital money. If so, like really necessary to have some financing solution there. If so, like let's say like really indirect people, direct people need to be involved one time, and they need to be same understanding. That's like a really one of the big column of like a go-to-market strategy, I think.
My one would be listen to the sage and wise words of Mike Tyson, which is everyone has a plan till you get punched in the face. And I think if you're a strategic marketer, your plans will look great because everything works in PowerPoint and everything works in Excel.
Mm.
And within those first few weeks of launch, you're going to realize that none of it's going to work. And I think the best, it's going to cost you 10 times as much and take you 10 times as long. And then also the sales team are going to hate you, by the way, as a strategic marketer, because you
Standard operating procedure.
it's standard operating. But the best people are the people who can survive that moment when it all falls to pieces and pivot and listen to the feedback, especially early on, because it's all theory until you get out there. And if the reps tell you one thing and the salespeople tell you one thing and your customers tell you things, take it all in. Doesn't mean you have to just immediately react, but understand what is going to work and what's not going to work. And I think the best people who have long careers are people who take it with a little bit of a sense of humor. They don't take it too seriously because you'll go, crazy because it always happens. Understand that the plan is just a plan and it's going to evolve. And those people who have the sensibility to be able to pivot and find out what does work and lean into what is working in each of the markets will be different. And I think that's the key thing. Just have a plan, but expect the plan's not going to work, and then pivot.
Oh, wow. It's absolutely brilliant.
Yeah. I also like really like kind of like a really something kind of plan to create, but like a next day like completely like throw out necessary. Yeah, like this is totally true. Yes, that's like a word.
It's not very Japanese either. Throughout the plan each time. This is wonderful. Thank you all so much for just the time and sharing your wisdom and making this conversation happen. And for me, during the editing process, like I'll go through this like 8 to 12 times. So I always just glean more pieces, and I'm sure that viewers have gotten a lot out of it as well. I'm assuming the best way for people to connect with you is on LinkedIn. So I'll just tag
100%. Okay. Yeah.
And thank you. That's all I got.
Absolutely. It's been an absolute pleasure. Thank you for the opportunity to talk to my friends in such a great format.
So, hey, friend, you made it to the end of this episode of Sunday Sips, and I'm so excited to share 5 big brain ideas with you from Steve, Tetsuya, and Kashif that I think will be incredibly helpful for you on your journey. That said, there was a lot of big brain ideas in this episode, so it's really hard for me to synthesize this, and I'd love to hear in the comments if I missed something, if there's something that stuck out to you, or if something I capture here was encouraging. So let's chat through this a little bit more in depth. First of all, I loved the intro banter between the 3 of them around how they met and interconnected with one another. And it's this idea that innovation follows global friendship. These are all incredible individuals who have lived in different global contexts, who have crossed paths through different, how would you describe this, like congresses, where you're going and presenting your technology and like sitting at an empty table and connecting. Or for me, learning about Kashif and Tetsuya through Steve Bell's content and building on the relationship of him haphazardly connecting with them at different events. So I'd encourage you to remember that this medtech community is actually really small. yes, there's like jobs and opportunities all over the world, and it's big, but like these friendships make it small, and you keep crossing paths with different people over time, over the years and decades, and to really cherish those relationships and friendships, because eventually you start to figure out like who do you want to build with, and that's a really cool thing. So I loved seeing them interact, and I'm sure that their banter behind the scenes is also occurring as they build in these spaces. Number two, this one comes out of MicroPort, 750 telesurgeries. And I loved Kashif's thoughts of anyone in the world will have access to top tier surgery. I believe Hinatoli also works with telesurgery. There's a lot of other solutions that are moving into the spaces when you also think about XCath and endovascular, neurovascular robots that we talked to at the end of the episode. And it's an area where when I was working on Otava, I didn't hear anything about this being an unmet need or important. I don't know, and I can't disclose what will happen with Otava at launch concerning that feature set, because I can't disclose that and I don't know that. But it's an area where the world has definitely shifted since I was actively working or building in that context. And it's really exciting to see how this opens up access to patients that are on the fringe or on the outskirts of society to still be able to get a robotic surgery from a top tier clinician who could be in a completely different country. And it's just a beautiful, wonderful world to think about. Number three, this has a lot to do with clinical immersions and being proximal to clinicians. This idea of like the worst thing you can ask a doctor is, what do you want? Which I agree with that sentiment 100%. Like, no, do not do that. You need to immerse, you need to pay attention, you need to find the pain points and identify the clinical unmet needs. This is an area that Moonlight Medical focuses on. We have a member of our team, Candace Otrembiak, who is trained in Stanford Biodesign. I've done 40 plus clinical immersions. And there's so many moments where you sit down with a surgeon after a procedure and you go through your post-operative interview and your notes, and you start like saying like, is this the pain? Is this really what's going on? And then your assumptions are challenged, and then you take it back and you think about where your innovation is and where you can nudge it, and then you bring it back to them. And it's a beautiful iterative process of empathetically listening and experiencing with them, but never saying, what do you want? Because when you say that, they're not going to be able to tell you. They just know how to cut people up and put them back together again. And that is a beautiful profession. But it's our job as marketeers to be able to pull out those insights and translate them back to engineers that make awesome stuff. And that's why I love global strategic marketing. I love engineering. It's my roots. But I speak engineer now, which is a lot of fun. Okay, number four. When we're talking about go-to-market strategies, they all piled on so many insights here. But I think one of my favorite ones, just in its simplicity from Nakanishi-san or Tetsuya, was go-to-market strategy is a team sport. That you have to be very collaborative about how you partner with everyone in the regions, all the clinicians. They said like the sales reps will hate you, which I experienced this in Japan, of just seeing how challenging it is for sales reps to position technology when the storytelling coming from, say, a US-centric marketing org doesn't translate conceptually into a region. And then you have regional marketers that have to translate it back. And like the cascade of partnership and storytelling all the way to the front line sales reps is really an art form. And it's something that's precious. As Steve talked about, like the best strategy, everyone's got a good strategy till they get punched in the face, which is a Tyson's quote. And really having like the resilience to keep adapting and shifting over time as you get those insights until you crush. Like no one starts a go-to-market strategy and it just outright is perfect. I loved that. That was a beautiful insight for me. And then the fifth one, which was the insight that surprised me the most in the whole dialogue, I was always operating under this assumption that you need to be first to market. And yet the majority of my career, J&J was always like a second, third, or fourth to market. And then they just slay with brand and scale. And Steve was sharing the story about like the second mouse gets the cheese. And it's the idea that the first mouse, the first mover, is the one that gets hit with the trap. They run into all the pain points and they get overrun by somebody else. And it's really weird because everybody's got to be moving and trying and iterating to actually get traction. And you're all jumping over each other's IP and trying to find the unmet need and launch a banger product and navigate reimbursement. And who's going to, navigate the pain first to then win. A rare exception to this rule is Intuitive just figured out how to get reimbursement working for them, and they slogged through that for years until it was profitable. And I think Kashif built on this really well, of this first mover advantage does not exist in medtech, which because it challenges everything we know about startups. But because reimbursement is so complex, there's a lot of factors that exist that can cause you to launch a banger piece of technology really off a bona fide unmet need and still have no way to sell it. And that risk is so great, and it occurs. A beautiful, terrible, sad example of just today, like vicarious surgery is kind of closing the doors, is at least what the board's proposing, and ending that space, which was a really interesting technology. And I have certain colleagues that had very candid thoughts about whether or not it should or shouldn't exist. And things like this happen in our market. You could progress things on hundreds of millions of dollars, and then it's not a fit at commercial, or a technical issue, or it's just slightly off the mark with the unmet need, or it doesn't scale to a large enough TAM. There's so many factors that can kill wonderful innovation. And it's an area that I'm deeply passionate about. I have so much respect for people taking risks to build solutions that heal on a global level. That's why I built Moonlight Medical. That's why I've been an all-in entrepreneur for 2 years and worked third shift and pulled my 401k and continued to build and try to provide value in these spaces, because I believe in healing on a global level, and it takes risks, and it's complex, and you got to have the right people at the table that are there to help you. So if you need any help, reach out to me. I got an awesome team. We're getting some stuff out the door for you. And that's all I got. Keep changing the world. Greetings from San Francisco. You can sip on that.
Well, thank you. I'm completely humbled, and I'm pleased to be here. And I support people who deserve supporting, and I think you deserve supporting. And you work hard, and that is one of the tenets that I've had for my entire career, which is work with people who want to really put the work in. So I appreciate what you do.
That's so beautiful. Thank you for the time and all the wisdom and just your joy and passion for these patients that you're advocating for. I'm really excited to see where Vessel moves next in the years to come. I'll be following you on LinkedIn naturally. And just again, I commend you for all the work you've done for the last years to actually see this close to market. And I trust that it's going to be a massive success and help a lot of people. So appreciate you.
Thank you so much, Joe. Thank you so much for your time and for having me on. It was a really amazing experience. So super glad to be here, and thank you very much.
Humbled and touche, by the way. Like, I love everything you said about me, but I think it is me who is watching you in awe of everything you have built, that you are creating, the spaces that you're creating, how you're amplifying unique voices that are not in the spaces you have been in professionally. It's been a joy to watch. When I talk about you to my friends and peers, it's like, you know what Joe did today? You know what video? You know what content? You know what he dared to share and talk about? So I talk about you in a very loving, nurturing, almost motherly way, because I'm so proud to see what you're creating and building. So it's my joy.
Gosh, it's so humbling.
Thank you, Joe. And I just have to just speak about you again for a second before we end this, which is just I'm just so impressed by your humility. I'm just so impressed by your ability to put your ego aside and listen and learn and really process what someone's saying to you. I think that's like a really rare gift. I'm so impressed by your intentionality, your thoughtfulness, and just your listening. You just have a listening for people that I think is so beautiful. And it's an honor to know you. You push me, you challenge me. I'm afraid of it. You sit with me in that. And I just can't wait to see where this continues to take you.
For sure. Thank you so much for having me. And I'm humbled really that our path crossed in the last couple of months. You bring very positive and growth mindset to this industry. With everything that you've been through, let's say probably like 90% of the population would be just knocked down. And you're just like, keep coming. So you continue what you do, and obviously you do it well. So thank you for everything you do for our community and for the world.
Was it fun? Did I do okay? Everything?
It was awesome. It was awesome. I loved it. Yeah, I think you've been one of the few that have actually captured the entirety of my career in a succinct conversation. So very rare.
Dude, this means so much to me. I've put a ton
man.
of time into it. I haven't worked through all 414 of your podcasts, so I apologize for my prep.
Dude, you don't have to prep for anything. Just start asking questions and we're gonna have a conversation, have fun. All good.
Cool. All right. So yeah, in my intro, just for context, because it trips people up sometimes, I run through like 3 reasons I'm so excited. So it's all the hook and retention.
Oh yeah, I know. I've watched your show.
Okay.
Yeah.
Oh my gosh, it's so humbling. Okay. I
Amazing.
tried to keep it really tight for you.
Yeah. Yeah.
That was great.
Okay.
Yeah.
Love telling
Keep
the
it punchy.
story and
Thank you.
cool. Okay.
Awesome.
It's time to go run.
Huh? You going running?
I'm gonna go run.
I
Oh
have
my
a
gosh.
A Synonix down here.
Yeah, I didn't know this is a kind of music session today.
Yeah, you didn't.
Oh my god, my kids are gonna love this. Yes. So hey friends, I just got a box from one of my clients, Ian McCatherine from Nerdian, and I've never done an unboxing video before because I've never had someone sponsor my content and send swag or whatever's in here. So I'm very excited. So I have a knife and I'm gonna rip this open. But I do want to show off, his box is super cool. He's got an astronaut on it and it's got a lovely quote from Neil Armstrong. I am and ever will be a White Sox pocket protector nerdy engineer born under the second law of thermodynamics, steeped in the steam tables. Oh my god, I forgot about steam tables. That was so hard. In love with free body diagrams, transformed by Laplace and propelled by compressive flow. As an engineer, I take a substantial amount of pride in the accomplishments of my profession. So I'm gonna rip this open. I'm gonna use 2 hands because I'm not a pro at this. So pretend you have a perfect top view. I'll be right. Okay, he also has custom Nerdian tape, which is super cool. So let's see what's in the box. Oh my gosh, I'm so excited. What? Okay, that's awesome. I need nerdy stuff, so we have Stonehenge wearing a hoodie. Fantastic. By the way, this is all the timestamps I'm taking because I'm in the middle of Ian's episode right now, trying to edit it. Oh my god, stay awesome. What? 1 second, I gotta look at it. Okay, this is legendary and awesome. He sent me a Costco gift card to stay awesome and go shopping for my family, which is super cool. And then this is a Maestro, like Letterman jacket, woven badge of an eagle, a chicken, and the moon. I'm assuming Maestro 1.0 is a badge for working on the Moon Surgical Maestro, which is so cool because I got to sit down with surgeons on behalf of Moon and film the unscripted series, interviewing clinicians, talking about their pain points and where Maestro provides value. So I'm an external consultant that got to touch something that was built and just help amplify it. So to get the 101 is super cool. Okay, let's see what else is in here. And a whole bunch of awesome business cards that I can hand out when I network on behalf of him. Oh my god, my kids are gonna love this. Yes! He's got a little moon. This is so nice. Oh my gosh, I have needed nerdy stuff to put behind me because my kids had Legos there and then my 2-year-old just destroyed them. This is so awesome. What else do we have? This pose. I feel like there's a joke for this Darth Vader that I don't fully know because I'm trying to recall the movies and I don't remember him ever doing this. Like the pose of Darth Vader I remember the most is him Emperor throwing the Emperor while he's getting electrocuted. Is that the no pose? The no! I think it is. Okay, I gotta look that up. There's a meme in that. And then we have a beautiful dragon. So for those of you who don't know Ian and what he does with Nerdian, he's got like $500,000 worth of engineering equipment in his lab, which is fantastic. So when we were working together, he made a podcast in a box, a robotic podcast in a box studio. This is so nice. Oh my gosh. And he was cranking multiple printers in parallel, trying to make all these fixtures for GoPros to sit on so I could have different perspectives, pull it in a Pelican case, and then we shot the whole episode on it. And I am so close to finishing these edits. Where are we? Like oh no.
I can't do this with one hand, but I'm like, I don't know, probably an hour out from getting it released. Okay, my other phone in here. Oh, I got another dragon. Oh my gosh, my kids are gonna love this so much. Oh, it's so fun. Oh, cool. It's so funny because I was thinking about sending him some swag. I'm not gonna tell him what it is. Okay, classic Army Man. We have the Sunday Sips Surgeon logo, freshly printed. Oh, I was eyeing these. He has these screwdrivers with a little ball joint in them. I forgot how you actually pop them in and out. It's got living hinges. I can't do it with one hand, so that you can pull this out and rotate it. I can't do it. One second. I got it sorted, but I can't do it with one hand. But he's got these living hinges in here, so it'll actually grab onto any standard drill bit, and I can't pop it back in with one hand, but it's super cool. And then we have some more Army men in here. This is so fun. Did he print these? No, I don't think so. Those are, oh, but he has an injection molder. I bet he injection molded these. Shoot, this is all. Okay, so the dark green ones are made in China. These ones are skateboarders. I think one of them's like a zombie. Although I almost want to feel like these are Tony Hawk characters, but I'm not fully sure. But I think he made some of those. And then we have enduring rings. Oh yeah. So I think he makes these as well. One second. All right, and naturally being the smart engineer I am, I put it on my pinky and I can't get it off. So I get to figure that out. But we got some 3D printed rings. And I think that's it. But Ian, thank you so much, friend. For those of you who don't know Ian McCathern's fantastic. I'll put a link to his Nerdian website. He also is, I think, the only injection molder within the San Francisco Bay Area. So if you're trying to do some prototypes, he's fantastic. I would say this is not a sponsored video, but it is a sponsored video because he's one of my first awesome clients. And he sent me a box and I decided to unbox it, which is cool. Appreciate you. Keep changing the world. Keep building awesome stuff. And I'm going to take this off before it breaks the circulation of my pinky.